Okay, good afternoon, everyone, and welcome to this webinar. My name is Kieran Stevens, and on behalf of Williams Medical, I'd like to take this opportunity to welcome everyone to this webinar on leading at your best, high performance in a changing NHS. In this session, we're going to talk about subjects such as how to lead through pressure, uncertainty, and change, maintaining focus and building resilient teams, and also creating conditions for your practice to excel in a new environment. This webinar is the 8th in our practice support series and is presented in partnership with the Institute of Health and Social Care Management. We are delighted to welcome Dudley Sawyer, Director of People Care Services today. So thanks for joining us, Dudley. A couple of pieces in terms of housekeeping. So this webinar is scheduled for 1 hour. We'd like to invite your comments and questions throughout the session. So if you do have a question, please use the chat function and this should just be at the top of your screen. This session will be recorded and will be available on our platforms shortly after the session. We'll also include some useful resources as part of our post-event communications. So, without further ado, I'd like to hand over to Dudley to start the session.
Thank you very much, everyone, for joining in today. Just a few pieces of housekeeping. If you can, kindly go on mute. I think we should be okay with that. But use the chat box to ask any questions throughout. If we don't get to answer them during the presentation, we'll have about 10 minutes at the end, so you can sort of store your questions up. When you thought of elements, please chat and interact with others, and it'll be very helpful. I know if you are in England right now, it depends which part, it's a reasonably warm day, so I would also suggest you have a nice, maybe, I was about to say drink, so be careful what I say, something like water or some beverage to help you through this sort of session. But other than that, I'm happy to have you, and please use the chat for any interactions. And let me know when everyone is ready. So my name's Dudley Sawyer. So thank you very much for everyone for joining in today. And I will be leading this session today in regards to high performance in changing NHS, and in the changing NHS, let's say. And we know that high performance is something that we all aspire to. And I think it's important, and not just aspiring to it, how do we manage it? We know that life is busy, the churn is also very real. And before you know it, you start your day and you finish your day, and before you know it's the next day. And someone once said to me, working in NHS is like Groundhog Day. But then how do we survive, and how do we support those around us as well? So thank you very much for joining in today. So if you can, in the chat, you can feel that you want to. I'm Dudley Sawyer, and as you can see, wherever I go, I know that one of the first things that people do is they look at you and they say, okay, who is this person? And they make their judgment. Secondly, they look at your names and they say how to pronounce the names. And if anyone knows how great the British are, every name is pronounceable. And for me, what I do is I like to break down my name phonetically, so there is no issue. So my name is Dudley Sawyer. And thank you very much for joining. Just to let you know, people will say, well, Dudley Sawyer is an easy name. I've been called Dudley on various occasions. So actually helping people to pronounce your name is a good form of leadership because it breaks down the barriers. So that's my first gift to you in regards to your high performance of leadership, is actually knowing people who you are. And my background, apart from a business strategist, social care and health consultant and trainer, I've worked on projects with the NHS and social care. I'm also a chair for the London Mayor's Talent Board for Health and Social Care as well. And I am a chair for a National Skills for Care for the Race Equity Reference Group as well. So these are some of the things that I do practice. So you can use the chat just to say where you're from, your name. If you want to have a go at phonetically breaking your name down, please do it. But I think it's one of the things that's good to take back with your teams. It's a good icebreaker as well. So why are we here, and why do we talk about this area? Well, I'm gathering that we've got various individuals. It could be whether you're practice managers, whether you're working as nurses, receptionists, NHS frontline, all across the board. The key thing for me is that really it's about how we manage our situations. And it's around understanding why high performing teams sometimes may struggle during constant change, recognize things like differences between surviving and thriving under pressure, and then just applying sort of practical leadership techniques to sort of build your resilient teams. We want you to improve prioritization during periods of uncertainty, which I think can be also essential. Also, create everyday conditions that really encourage high performance. And for me, I think that's the reality of it as well. Um, One of the things that's important for me is that when I ever go to any form of training or webinars, it's always a case of where there is sometimes so much information to unpick. For me, it's really about when you come in, you leave with something a little more than when you came into the room. And for me, it's about a mind shift action. So the information that you receive, which I think is going to be fantastic, I would say that. But the other element of it is that it's about taking something from today and actually putting into action, not just listening to it and actually saying, oh, that was a nice to have, but actually, how can you implement it? And we know that's the case. And I think for me, it's really a key element. So please, for me, it's about actually taking on board something from today. Even if it's one thing that you leave here with and action it, please do. If you can do everything, then even better. So without really slowing down the process, as we don't have long, I think it's important when we set the scenes of really of the lives that we're leading at the moment. So if you're a practice manager or whatever role that you're playing with in sort of like health and social care in the NHS, you're probably thinking that things are really full on. You're constantly having phones ringing, emails at your doorstep, staff knocking your door, or the reality is that you might have members of staff sick. I'm not going to go into Monday morning for those staff that never turned up, or those who had hardly any sleep. But we've got things like new guidance that's landed in, you've got frustrated patients or people that you have to attend. You could have an inspection coming up, and you have to deal with all of this really under the day-to-day elements and guise of the pressure of what you're dealing with. So how do you lead when everyone is overwhelmed, including yourself? So it's really interesting when we set the scene, and that's me talking about your mind shift. You're working into not just literally a mind shift, but a minefield for some, and that can be your reality. And for me, it's important to understand that. And as a group, and everyone here and those who are attending, it'd be good to sort of find out which word best describes when you think about leadership in today's NHS and what your thought process is at. And please use the chat box just to sort of like share your thoughts of sort of words that come to mind. It'd be good to just have an array of it. And I'll give you about 30 seconds just to just share some of the sort of like your answers in the chat. Please, it'll be interesting to know what you think about the leadership in today's NHS. Yes, you can go general, but also really more related to your own sort of area and team. And you don't have to go into an essay. With just one word will do, or one or two words, just to give your overview. That'd be great. Okay, I see some of them coming in. Okay, so the reality of it is for me is whatever you selected, you're certainly not alone when we think about this. I think we have to be realistic in what we're doing and how we think about it. And I think it's really interesting when we think about leadership in this day and age and how we manage it. I'm gonna put an image up, and it'll be very interesting when you see this image. When we talk about leaders in today's day and age, and some of it is that the reality of our situation means that leadership can come in various guises. You can put your hand up if you actually if you like football first and foremost, and if you don't, well, I apologize today, but unfortunately the theme today is going to be football and English football, and not everyone supports England, I know that, but we're talking about the actual match in itself. For those who actually managed to watch it, when we think about these two individuals and we think about leaders, it's very interesting what comes to mind. So we think about when we think about these two, and one of them is the captain of the England team, and one of them is a very influential player. But when we think about this, we see them as both as leaders. One is Harry Kane, the captain of England, and one is Jude Bellingham, the other individual who scored 2 goals to help England win their match 3-2 against which was a resilient match that took place. And I think when we talk about at Mexico, and it was very interesting because we talk about the settings you're usually in. England went to play at the home of the main stadium of the Azteca Stadium in Mexico of the Mexican team. And the majority of the fan base were Mexicans, and they were all against mainly the English team. So we talk about pressure in today's environment. We're talking about having to deliver. We're talking about eyeballs on you, and the reality of if you get things wrong, it's really magnified tenfold. We hear the noise, and you've got to deal with this on a day-to-day basis. And so I love this image because people would usually say the person in charge of the organization is either the captain or here we have is Thomas Tuchel, who is the manager of the English team. And it's interesting because when we talk about leadership, I always say, who is the leader? Who's the person in charge? Is it, for example, yourself? Is it the person, your line manager, the person at the top of the tree? Who is important? So who do we clarify as the leader? So it'd be interesting to say, when you think about the English football team, for those who have can bear that in mind, who do you think as the person's leader? Is it the manager, Thomas Tuchel, or is it the captain, Harry Kane, or is it probably the most influential player on the pitch or in your team? And it's quite interesting when we talk about leadership today. Leadership really comes in the high performance in a changing sort of like environment like the NHS can be anyone can be a leader. In fact, everyone today is a leader in some format. And every time I realize that at various events, and then you put a line of who thinks they're a leader and who thinks they're a manager. And I was speaking to a load of very well-to-do managers and once, and I asked them of how many of them were leaders. Only 10% of them saw themselves as leaders, which was I was quite shocked because when we think about it, it's not just your manager, as we saw in the English football team, that actually was the person who is the leader. We saw the captain who can be a leader, but also a person who isn't the captain, just one of your good team players is also a leader. So everyone can lead today. So this isn't just for someone who has a title by their name of leader or manager or senior leader or director. Actually, it's for everyone and how they actually practice it. And this is really the key element for me when we talk about today's event. It's not just leading from behind, but leading together. And there are various different elements of leaders. And as we saw in the English match, and I will say it again, you have strikers, you had defenders, you have midfielders, you have a goalkeeper, and all of them play different roles in the way that they are. They're all different individuals. And so leaders today can be deemed to be compassionate, they can be efficient, um, and also innovative, financially aware, emotionally intelligent, really, digitally capable. All these sorts of things are elements around what we see now from our leaders, and it can really apply for all the things under them. And it's around understanding how to work in pressured environments. How do you think about dealing with all the pressure that comes for you? I think it happens that the reality of what we expect and what we experience is that under pressure, things can happen like mistakes. You're dealing with sickness, frustration. Maybe a lot of the time I hear these days reduced compassion because we hear that people are so hardened with dealing with things on a day to day that the element of being compassionate to people is reduced. We also, as well, the reality of leadership as well is that there's potentially going to be conflict within your teams where one person doesn't get on with someone else. How do you manage that? Then you've got people who are leaving. We know there can be a turnaround of staff and people that have been there for a while. How do you manage it? I think these are some of the challenges that you have to deal with, and always say the hardest sort of word to think and deal with is change. And I think it's important. And people really struggle when it comes to change, and because it can create things like uncertainty, confusion, poor communication, losing control. And for me, it's about how do we share that? one of the things I always loved in starting out working in sort of health and social care was the handover. The notes are really important. If you don't have accurate notes, how can you apply what you have to deal with and deliver? So for me, it comes with really about clarity in regards to what you're doing on a day-to-day basis, actually sharing information, giving the correct information as useful as it can. And because, things can change and it's important, when we think about that. So we think about that, think of it in your sense of what the words would be. And if we was to say into a framework, I would say three words that come into play. That would be clarity, confidence, and connection. With confidence, if you start, many people start a new role at the beginning, they may lack confidence. How do we gain or give people the confidence they're able to share the right information? So they're also consistent. But it's not just about that, it's about giving people visibility, the ability to be able to say, okay, have you got something to say? And this happens with team meetings where people are all given the opportunity. As I said, I've worked in really inclusive environments. It means then that not just the same person answering the question all the time or the person who was winning everything. What about the staff who probably aren't as confident? How do we help them? How do we keep them visible? We really want them to be honest. And that open door policy really helps with the high performance teams. So because things are so busy, someone will say to you, well, why didn't you tell me? And they'll say, well, I thought you were too busy as well. So actually as well, giving people the ability to be able to speak out as well. Connection, be able to ask questions, listen, involve people as well. I think it's important that we really are taking things on board. One of the things I always say that you can learn from is don't really just listen to respond. When people speak, you listen to understand, not just to respond, because a lot of time we're very quick to snap back and give our points of view. But when you actually are listening to understand, you can actually hear, and this could be a patient, it could be your fellow colleague. Understanding someone and where they stand is really important for me. I think it is how we get to learn and develop as teams. And if I speak to you or you spoke to me and I actually listen to you to understand, how would you feel? You're going to feel a lot more better and more infused. And actually, you will say, okay, this person really listens to me. So as a leader, I'll take things on board. We know pressure environments, some of the people who don't listen, they respond. Why did you do that? Oh, and so people then don't actually come to you, which then takes it away from what you're doing. So in your team, you don't want people to be frustrated. You don't want it to be sort of difficulty. We want people to be able to speak through and be able to help. And this is really important for me because when we do this, it really helps us to build together. As a role and what I did during COVID, we went and we spoke to a lot of teams and we had the benefit of actually removing the management from the teams and they then had the staff in there and the staff would respond without the management and they were very truthful of what they thought about the actual management in the organization. It was very a revealing exercise and what I had to do was to build almost like a conduit to sort of like the feedback to the management team and the leadership team about actually what they thought of and how they managed the teams. It was quite intriguing. So that as an exercise is really important. So actually remember, even if you don't have the best open door policy, there may be the factor in that people are going to speak about you whether they like you or not. So if they like you, they're going to say good things. If they don't like you, they're going to say bad things. So do remember that as well. So when we think about this, there was, and I'm going to go back and how there'll be, I apologize for references for the English football team. So during and before the match before, there were questions about the English team, and there was a certain position in the English team, whether that the team, they had the right person in the role. But what you found was during the match, the team came together. And when the team came together, they actually provided actually a place for everyone to sort of shine. And this is where we think about building resilient teams. Building resilient teams means no matter what everyone's role, they play a part in it. And it all leads to a great team and output. And that's something that helps with leadership. It means no, we know that there's the manager or maybe a top performer in your team may be the people that look to, but without the others, no one else, it doesn't come together. And so this is why I say leaders isn't something without everyone's input. So from someone at the bottom end to someone at the top end, celebrating everyone's participation. Because if England win the World Cup, we hope that they do, everyone's going to be celebrating. Everyone in the team's going to be given probably a knighthood, maybe, or whatever it is. But actually, it's about how we support teams. And when we saw what happened in the match, one of the England players was sent off and they were under pressure. So when we're under pressure, what do we do? Question I'll ask to all of you. If you're under pressure, if you lose a member of the team, what do you do? What happens if you're your team? Do you fold? Do you implode? And what the English team showed is that they were resilient, very resilient for, I think, 20 minutes of really trying to really stand in. The substitutions came in. They also came in. So new team members will come in. They will grab what they will see on the ground and they will join in. And these are sort of challenges that help you to grow and to be resilient. So it's really important of how you do it. It's about providing really elements, which I say things on your working environment, providing psychological safety, where people can speak honestly, because that's the grounding of it. Purpose. What's the purpose? If your staff know the purpose as a leader of what you have to do, it gives them something to aim for. The purpose for the English team was to win at all cost. That's what they had to do to get through to the next round. So their purpose was very clear. Is your purpose clear when you think about the team? A belonging. Are you part of a team, or the team really disjointed? Do you feel valued in your team, or do you just feel just like a cog in the wheel that turns when you turn up? So having a belonging is as a critical as almost as having a purpose. Because if you belong in the team, you know your role, you know what you have to do. If you're not there, then the team can fall down. So being there is also important. But having the energy, we've seen one of the things that happens during the football matches in the World Cup is they have hydration breaks. So in order for the energy to continue, are there breaks? Do you have boundaries? Are you able to recover? Because if a team works throughout and there is no rest, then the team really collapses. So having that energy is important. And I think it's a key element for that. And the next one for me is recognition, because we work so hard, we turn up, and at the end of the day, like I found when I got feedback from not the team, they said, we don't get recognized. In fact, what do they give us for this? Yes, you get paid, but recognition is important, that actually people are recognized. And that we saw in the English team where the recognition was important. Yes, you've got two of the people there on the screen, but actually as a whole, the recognition is there. And for me, my final point that I would add to this is an interesting one, is one thing I've worked with when working with psychotherapists as well is reflection. People call it debrief, whatever what you have. So some of the time we don't get to see near misses, or if there's an issue that's happened, actually, rather than pinpointing and pointing at someone's done something wrong, having reflective sessions is so important for me, because actually it gives people room to maybe share maybe what happened, what could we have done better. And then going forward, they're really solution driven. And I'm very solution driven of what happens next. And I think it's important that we do that and have a look what's happening. Without that solution, really, we struggle. It's a story that we have in regards to how we move forward. And I think for me, it's about really the real life example of what we do, and our intentions, and how do we remain, focused really in a changing environment that we have. All those things are very easy for me to say, but in real time, how can we do it? It's about you setting things in place, also allowing people to make sure, how do we look at things better? I always get the elements of surrounding when I'm in environments, it's everything's urgent, everything's has to be done like yesterday, but does it? What can we prioritize? What makes sense? Are we just being reactive all around us? Are we being proactive? Proactive means that ahead of time we know what to do. It's very easy enough for me to turn around and say, we know it's hot. Do we look at the weather forecast and say for the next 2 weeks it's going to be hot? So do we actually add hydration, water breaks? Do we support our team in that sense of, do we react of when everything is like, I'm tired, I'm hot? Do we have fans? Or are you that individual that buys fans and reacts? And when you go to the superstore, there's no fans left because everyone's had that thought. So how do we work as a team And then how do we be intentional, set the bar that everyone has that thought process. And I think it's important for me when we do this. And I love these sessions because leaders don't just stop. And one of the things for me is the leader of the organization can set the tone of the organization. We look at the people, as I said, with what a good leader looks like. And many of you can turn around and maybe mention what they think is a good leader. Um, but easy enough, you tell me examples of what a bad leader is and what you don't like. And I'll bet your bottom dollar that most of you, if you go back, and I always like this, if you grew up, what you deemed was a good teacher and a bad teacher. And many of you will remember when you think of people who taught you, who you thought is good, who you'd like to sort of teach you, and those who are bad. And so for me, leadership is more than just that. As I said, it's a mind shift of what you do and what you look at. And it's about how we go beyond that. So if we think about all the basic elements, create the ground level where everyone feels valued as best as possible. And we know there's some troublesome staff, but then actually, how do we get the teams to come together? Because we know we're all trees as individuals, but when it comes to a storm, if we act together as a forest, then we're likely to sort of knock away and repel all the rain and all the thunder, and we're able to protect ourselves. So bringing it together is more important than not, and we think about trying to really work as a team. So all those said, we can talk about all the things that lead up to the ground, but really going forward, how do we create conditions for an excellence? Because we want to have high performing teams. We want to be the standout team. We want people to say, you know what, I want to work in that place. What can we do? How can we work around it? What makes your organization or your team or department better than others? And when it comes to struggles, when people say to me and speak about things like CQC, they always say, I want to be outstanding. I don't want to be just good. I always want to be there. How do we get to that outstanding? What systems do you have in place? And it comes down to your culture, the conversations you have, having elements. And these are all sorts of small things that you can do. You can make people feel comfortable. You can have things outside of work that people can come to if they wish to. You can recognize the different diversities of your team. It may be, for example, if you have, for example, a lot of Muslim or Islamic staff, you may celebrate Eid, or you can have days of international workforce of what's great about your culture, and they can bring in food dishes. And, it's all of these things are really important. So these are things that I always say are really a starting point, but they don't really cost anything. It's really more engagement with your staff. But for yourself, you might want to say, let me have more of a high performance formula. So going back to really simple things, what's the clear purpose for you and your team? Do you know the purpose of your organization? And is that translated to you on the ground? But it's about trust as well, because I can say, I want you to be the best worker possible. But if they don't trust in you, or if you're telling them to do things which are very almost impossible, the trust sort of like diminishes. So actually getting a trust is really important, because if someone trusts you, they're likely, like we saw in the English football team, to run down and really break down doors, really stand up, be counted. You're out on your feet, but you're still going to give that extra mile as well. Do you have your communication in place? So when you leave here, what communication are you going to share with your team? Are you going to say, well, there was this interesting person that was speaking and they said this, blah, 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 blah. As I said before, take one thing, action it. So it might be getting the clear purpose, having trust, communication. Communication varies in so many different ways. Some are visual communicators, some emails. We know so much. I had various emails that were sent to me. Some was missed because I didn't go through it. Had so many emails to go through. I missed that. So how can we share elements where people get to share information? Do you put a notice on the board? Do you have a personal read receipt? All these things really helps with communication. Without good communication, people struggle. If they say, the communication is really bad here, they didn't tell me that I had to turn up, or so forth, then it's really bad. Or for example, some people may not have turned up for work on Monday morning, or were slightly late. Did people come in, send a message saying, I'm running slightly late? I'm not going to tell you. They probably didn't tell you why they were late. And they probably said there's a bus running late or so forth. But how open is your communication policy? And outside of it, I think some of the best teams I've been in is, if I've come in early, am I learning from the team? And this could be learning from what we see around us, or being able to ability to take courses to upskill yourself, All these sorts of things help us as an individual to really help. And the psychological safety, do we feel comfortable if we've got something wrong that we're not going to be berated or are going to be in trouble? So I think there's also an element around psychological safety about feeling comfortable to be able to speak your mind rather than gossiping in the corner, or as I found when I was at in that meeting with all the staff, that they said some very interesting things about their management and leadership team. So it's good to sort of like break down barriers, whether it's in supervision or whatever you have it in, or having reflective sessions, I said, are really good as well. And as I said, recognition as well, it's good because there was a singer that I met and she said, Heather Small, and she said to me, Dudley, my life, I was going through my life. I never stopped to actually recognize my accolades. And I wish I did at the time. So actually recognition, you can have recognition anytime, whether you're doing employee of the month, week, year, award ceremonies, recognition is also really important. So this helps with the teams. As small as it may seem, it's always nice to have as well. And this really helps for us in really thinking about high performance teams. It's about building also one of the things I believe in is it's not just about just all what I've said, which I hope you embody, but then it becomes, if you do it often enough, it becomes part of the culture of your organization. And the culture is also very important because a leader can set the tone, but the culture can actually keep it running as well. So the importance is that if that leader disappears tomorrow, is everyone going to stop? And usually you find that leaders, great leaders, if they lead, if they don't embed elements of what they can do, once they leave, that culture stops. So we want the culture to run through it. It's about creating the awareness, educating, but that's actioning on what we do as well. And that for me is really important for me because once you do that, it becomes part and parcel of the policy and the everyday behavior and of your organization. But outside of that, it's something that if you heard something great, the likelihood is you're going to share it and it's shared. So you want all the good work to be shared. So the leadership element speaks for itself, and it goes from that. So for me, it's going on what happens. So I will say to you, and I want you to take this away from you with you as well as today. What will you start when you leave here? And also as well, if you think of bad practices, what will you stop? You write these down for yourself, and then what will you continue with? So, what will you start to do once you leave here? If you haven't done it already, what do you think you could stop, which is important? And you can just look around, and this may be just asking, maybe after full supervisions of maybe your staff and team of what you think could stop, and the unnecessary one organization. When I was working in the NHS, we used to have team meetings every Monday, and it was everyone was there, and it was like a long day, and it was team meetings after team meeting after team meetings, and by the end of the day, you couldn't remember, but you just remember that you were in meetings. And so, actually, how do we make these meetings more fruitful? So it could be something around that of what you could stop, and then how you could start. And in the good practices, it's all about what the things that you can do in regards to that. For me, it's important when we think about those sorts of elements around that, because I think without the elements of the individuals that we have, it also diminishes as well. So what goal settings can we set from today? And yes, I know it's a very football related themed session today, but actually the goal settings is important for me. It's about how we manage sort of the goals that we're dealing with and how we're working with. And I think it's important for me when we think about that. So do think about goals that you can set for yourself. I always say, think 3 steps ahead, because when you have a decision, most times, most people thought about it from a business point of view. So actually 3 steps ahead prepares you. So you have your calendar. I have a calendar. I mean, I have a book which sets my calendar for a 2 year spread. So I'm able to sort of work over like 2 years rather than 1 year ahead. So it allows me to give me that purpose and to put things in place. So I think it's important for that, for elements around that. And I think it's a key element. So some of the things that I've found is that If you can see here, and why write down goals? Well, I think it's good because you get to sort of like, if you say, if it's not written down, it doesn't exist. Actually, you can set some things on walls and goals that people can look at. Because if you write down something often enough or you say it enough, it's something that becomes second nature. And so goal clarity is a direct influence and overall motivation in the workplace. So if you goal set and you speak about it, or even if you bring people in to speak, they actually listen to them. Hopefully, today you're listening to me, and maybe you can actually may make a difference. Because if you hear the same voice over and over and over and over again, it's sometimes you think, okay, that person again. Okay, yeah, okay, whatever. But the element of it is actually having it somewhere. It might mean something. But setting more challenging goals as well means to leading to achieving more. So you may think that, okay, I've got this, I can easily do that, but maybe we can now set goals which are more challenging, which may make us step up. So, as I said earlier, when it comes to maybe CQC inspections, people say, oh, I'm aiming for good, but maybe let's aim for outstanding. What's the plan? Let's have a roadmap. What can we put in place so things can be different? Having the roadmaps is really good, but also during that, give areas where you can receive feedback, and then how to then elements of motivation and goal successes. So don't wait till the end of the match, which we usually wait through, but actually during the whole process, what things can we do that actually help us to actually get to where we need to get to? I think for me, it's a key element, not just to do things on just waiting for the long run, but actually what can we do in the short term? And that can be also helpful. And one thing I always find is interesting, and 384 tests have shown that goal setting has a statistically significant effect on behavior. It affects your behavior. And don't take my word, as you can see, there's been various tests that have been set around where actually, if you goal set with people, and this is maybe in your supervisions, actually it might mean something. And I think for me, it's a key element of how we do it. I think goal setting it has its own motivations, but you can set the bar and raise it a bit more. Um, and those goal settings are really things that are really achievable for me. And I really like that because everyone has their different goals, but then we have one main goal, but you can all have individual goals as well. And all these things help from a point of view which helps us manage what we intend to do. But it gives you also a sort of like an area of what we think of your staff. And because there are so many maybe different colleagues in your organization, and some of you may work in smaller teams where it's easier to manage, and some of you work in larger teams. So you work with larger teams. How do you manage to get through to everyone? I always say something can be challenging, but by setting the sort of main goals is a key element for me. I think it sometimes can be hard because one of the motivational goals might be a promotion. And what happens if someone doesn't get a promotion and someone else gets a promotion instead? But you can create certain roles, champions, side steps, because I think sometimes it's good to have a side step to take an up step. If I was anyone who was going to share of when someone doesn't get the promotion, I said, okay, so if someone doesn't get a promotion, you give them maybe another role, which is a sidestep role, which is helpful and on their day-to-day basis. And now, if you apply for another job in the future and they look at your CV or your record of what you've done, they say, oh, you did this, you did that. Oh, we also did that. Don't necessarily say, okay, that was a side step, that was an up step. They actually see the range of different things that you do. And I think now the more things that you're involved with is actually really helpful for future employers or when you are going to go for your next promotion, because it really gives people the broad range of your skill set. And I think it's important for me in regards to that, of how we sort of manage that. And if I myself, Dudley, is just a really mild-mannered human being, and I tell you that all of this is wonderful, well, take it from people like CQC. They say, in regards to leadership, the quality of leadership directly influences the quality of care. So if all of this is said and done, we may not be here to be an English football team to win the actual World Cup, but our daily basis to really think about the people receiving care at the end of it. If we think of it, the whole big sort of like pyramid that's there, it leads to a patient or someone receiving the best quality of care. And it comes through from administrators. It could be people working in sort of like the HR department, frontline, all of this plays a big role in the leadership to actually deliver on the quality of care. So it's turning things around and thinking at the end of it, we're thinking about the person receiving the best quality of care that we can deliver on it. How do we do this? And by that, you actually look at your processes, look what you've got in place, look what happens when things go down. Say, for example, your laptop went down or the systems went down. Do you stop the level of care? You don't. Actually, you still continue care. We're talking about elements around AI and all these sorts of things that do take place. And I know it's very real and it can affect and impact on people's jobs. But as an industry in health and care, actually, what we try and do is to make sure that the person receiving the care is still going to have, at the moment, human touch for now. And that quality is led by you. And the greatest feedback is someone who's receiving care and support, and as a patient, their feedback was that they were treated kindly, it impacted on them, they enjoyed themselves, and it helped them actually in their recovery. I think these are some of the important things that we look at as well in regards to that. So I think it's a key element for that. For me, I think it's what you can look at as well. Um, Rather than really go too far into it, I think one of the things is very evident that there are different types of leaders as well. And there are so many various styles that we could use and utilize. It's about yourself and your best qualities as you as a leader. And I mean, I can turn around and say being compassionate is important for me, inclusive leadership, but then it's all capabilities that you have as well and looking at yourself. So the first and most important thing for all of you as well as individuals is to look at yourself as an individual, not the others, because everyone blames the team. But do you feel that someone would you come to yourself? Are you compassionate? Do you feel that you're doing the thing? Because the leaders that bark out orders and you don't see them doing anything, those staff say, oh, that person's so lazy, telling me what to do. Oh, can they do that? Do people believe in you that you can also do that? But then also when times are tough, how innovative are you? What things can you create? Or do you ask people to be involved as well? Say, okay, as a team, we want to be innovative, bring people to the table of what they can do going forward. Maybe their idea may not be taken up today, but tomorrow at some point it can be noted and, as I said, written down. You also understand that some people get bonuses, work extra long time, and financially, the cost of living and the cost of care and everything like that, it's really vital right now. It's tough out there. So as leaders, asking people to stay extra or they've got other life commitments is about really seeing how you can work with people. If they want to give that extra mile, how can we support them? How can we look into that? But do it under the guise of being emotionally intelligent. It's easy for me to say about being emotionally intelligent, but I think it's a key thing. If you say please to someone, it doesn't hurt to say thank you and please. That's one of the things I was taught from my parents. Please and thank you doesn't cost a thing. It's entirely up to how you do it. So delivery is also important. Understanding as well that some people may be going through different things at this also time. So how emotionally intelligent are we as a group? Are we understanding that some people may struggle? Some people may get things on the first occasion. Some people may get things on the third or fourth occasion. Obviously you have to understand, you have to also be realistic, but do you need support? Do you need help? We work in a forever inclusive environment. We know there are elements around different characteristics now. We know that individuals may have elements around where they may be neurodivergent. There are elements around what's taking place. There's gender differences. There's so many things that we understand, and people how they turn up. I mean, in so many things. So being inclusive in an environment is really important. But sharing that information is important as well, because some are going to be more digitally adaptable than others. Some will be very good at social media. Some may be tech phobes. But actually, how do you bring your team together where everyone's receiving the right information and in a good way? I think for me, it's really important. And I think for me, it's about sharing some of the things of how we do. Um, So that quality of care is something that you can sort of have as part of what we're trying to do and trying to aim here. So it's really having sort of clarity of that, as I said before. So really do ask yourselves while you're sort of setting your goals in regards to that. What will you start? What will you stop? And what you continue? I think for me, I think the other side, I think, if we have to be honest, is that change is inevitable. What could be good and great yesterday may not be good and great tomorrow. And now with the influx of AI and other generative sort of elements, we've got to realize how and these things are moving so fast and so quickly. But just because things are moving quickly, it's about also making sure it can be evidenced, how people speak up, having intention. I think that's also about that as well, and being realistic. Because where it seems as if now we're in this digital era where we just asked for things a lot more quicker, and burnout will be inevitable in the way we are. You can't pour from an empty cup, and your cup, if it's overflowing, then your team are struggling as well. So they may need you as much as anything. And so a leader's not present can be a leader that doesn't exist. So being present is important. Don't just be one of those individuals that sends emails, but be in person, show yourself, those meetings that take place, be there, maybe speak your story and people get to understand it. It's funny because if people hear your story enough, even though they say, "Oh, yeah, I've heard that story before," but they remember you by it. And I think it's important. And through that culture, it's always good. Um, and for me, I think it's important because we hear that a lot of patients who are receiving care, the quality of the patient care will never consistently exceed the quality of the culture experienced by the people delivering it. I'm going to read that out again. The quality of patient care will never consistently exceed the quality of the culture experienced by the people delivering it. So if you ever find yourself in a hospital bed or on the end of care, you will see what's around you. People could be able to tell very quickly what doesn't look right and what does. And for me, it's important when we look at that. So put things in place, have things such as you're leading through change. As I said, it's about communication. It's about obviously looking around elements around those three C's, which are important for me, as I said to you earlier. Actually, if you don't have them, of having clarity, confidence, connection, use that as yourself as individuals and let your staff know, do you feel confident? Do you feel you're able to speak up, or is there clarity, and is there connection? In other words, is there listening, when people are in or going through bad experiences, is there something there that's there for them? I think for me it's important. Having, reflection sessions is important. Maybe if you want, having in that reflection sessions, maybe a team huddle. We know the English team, they come together at the beginning of the match. As I said, the forest is as important as the trees that are in the forest because they build together resilience together. And actually, even if you're a small tree or the biggest tree, you've got the most leaves, actually you are still a forest together, and let your team know that. And then the other side is maybe yourself, because I find with a lot of leaders, they're good at supervising others, but who is supervising them? Who's keeping you on your toes? So maybe being part of a peer group or having personal leadership action plans for yourself, or maybe a reflective amongst your sort of managers and team members, really that's important. And this really helps people with that in regards to that. And for me, one of the things I always say is really key for me is before I leave anywhere, every room I'm in, I always say this is important, is that, and Maya Angelou, who was a famous American lady who really wrote lots of things, she said, I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. And I think if you can leave there with making or helping people feel really comfortable and fulfilling, then I think that's half the job done. Unfortunately, under pressure environments, when you talk about it, it's very hard to convey because everyone's going to complain. They're going to talk about your measurements, especially from a senior level. You have all these things that you have to achieve, your KPIs, your metrics, and you are judged by that. And you think, oh, I've given 10 years of my life for this organization, and all they can do is measure me by my output of the amount of patients that come through the door, or if our beds are full, or if people leave in time, or the reality of the care and the quality of what we're doing. If that's the case, then how do you feel valued? So the value of yourself and your staff, how do they feel valued? Is it lost in the purpose of your organization? Is it something that we can share? Is it something we can move? We really want to be sure that not only is that, we want our teams to be self-motivated. For the person coming at the ground, the new person, how do we get them to want to stay in the organization? In fact, it'll be great, because what I sometimes do is, when I get a round of people, I find the person who's been in the organization for the longest and the person who's just come. And really, then we sort of like spread one or two, and then they ask the individual, why were they here for so long? And then that gives them a reason that, actually, if you have lots of people stay in your organization for long periods of time, it gives you an indication of what you've got. So maybe an exercise you can do is how long people stayed in your organization. So you've got a lot of people that stayed for a long period of time. It really shows elements around why they're staying. That gives purpose. Also, there might have been good leadership from above, or the company values are really good as well. But then if you have an organization where the turnaround is very short, then maybe it's, why are we doing this? You might be getting lots of agency staff in, or staff that probably aren't committed. Do they see the values of the organization, and why are they not staying? People easily turning away and leaving just for money. We know that people just leave for money. But if the values, so I would put this to you, would you ask any of this question, would you rather stay in an organization where the pay was relatively good and the values and the culture was good, or would you leave just for the money, just go to an organization where the culture and value weren't good, but you were paid probably more and bonuses were more? So it's a question you ask yourself. In a long run, you may think, and it'll speak for yourself of what you can do. Someone sort of flipped that on their head to me when I asked them that question, and says, do you know what? I would go where there's more money, but then I would then try to make sure there's a culture change in there. So it means then that the good values that I demonstrate can be shared within the organization, which allows you to also support and do that. So it's a bit of a hybrid sort of answer. But, for me, it's important when we talk about really the pressure and the high performance, especially in challenging environment, it's a key element for that. That's here for me. So thank you very much for really joining on with me with this today. I think part of today's support, really, when we talk about Williams Medical, you can see here, it's really about supporting them, and as a partner of choice, for sort of like thousands of health sort of professionals. It's about trust, and it's about how you deliver on an everyday basis, having things at hand, because they always say a bad work person blames their tools. So if you don't have the tools and things that you need, then how are you going to perform? So actually that's important. Having someone that's here to help and a trusted partner is also as important. So I think for me, it's a key element here when we think about that, and really it's time really of what to do and how you move forward in regards to that. So I would now leave it open for anyone to ask any questions. I can't see the chat, so you have one over me. So if anyone wants to ask any questions or any experiences I've had, and I've worked across multiple teams, led, I am still leading and part of things, but it's also so many things that we can need and support each other. It's quite intriguing. So thank you very much, and I leave the floor open. If there are any one or two questions, I'll be happy to answer them.
Brilliant. Thank you, Dudley. A very thought-provoking session with some really great guidance there. I'm sure everyone on the call will agree. The chat has been fairly quiet throughout the session, so I'm hoping that's because everyone's waiting until the end to ask some questions. But what we'll do is I'll give everyone a couple of minutes to ask some questions now while I just run through some information, and then we'll revisit that in a couple of minutes. But yeah, once again, thank you, Dudley. I am pleased to confirm that we will be delivering more education throughout 2026. So please keep an eye out on our social media channels as well as our webinar registration page. I'll pop that in the chat in a second for future events. And yeah, as an attendee of this session, you'll also be notified of any future events. This is the last of our sessions before the summer holidays, but we do have an action-packed agenda ready from September onwards. The good news is that despite some of the potential challenges that we've sort of referenced today, Williams Medical will be here to support you as one of the leading partners for healthcare professionals in primary care. We are dedicated to supporting your everyday, both from a service perspective and also through added value and education, as we've delivered in partnership with Dudley and the IHS CM today. I'd also like to remind you that you can earn rewards every time you shop with Williams Plus. This is our reward scheme at Williams Medical, and this applies to products in our disposables, pharmaceutical and equipment categories, as well as our medical services division. So you can find out more about your eligibility and enroll by visiting wms.co.uk/Williams Plus. So I'm just going to double check. We still don't have any questions, Dudley, but I'm going to ask one in the
Go ahead.
meantime. Just, you obviously referenced the sort of start, stop, continue method. For everyone, I guess, on the session, what is the one thing that everyone could do in the next month to sort of improve or kickstart their leadership capability?
Are you asking me, or or you want someone to sort of like give their opinion? I mean, I can suggest various things of what you could do. I think one of the things I find it quite interesting, especially when it comes to leadership, I think everyone has a set model of what is a great leadership model, and I think it's really a key element here. But I think it really starts from your own organization, because every organization is slightly different. And sometimes when you take the model of an organization, let's say I'm using Teams Microsoft today. So let's say we're using Teams and Bill Gates of his model, and we try and put it into our organization. Sometimes it doesn't fit. I think the reality of it is really about really breaking down what your team looks like, what are the sort of the challenges that you have, and things that you probably could remove. I give you an example. There a working environment where there were a lot of parents who had to collect their children, for example, at sort of 3:30 or 3 o'clock. And so there was an issue because a lot of people wanted to work part-time. And so what happened was there were changes that were set to the hours so people could work at different hours to incorporate that. So there was the element of that as well. So what things could you start? What things could you improve on? I think there's an element around that that's important for me. So when we look about start and stop and what things you can change, I think it's about implementing, actually looking at your practice right now of what's good, what do you think is good that's continuing, but then also as well, get feedback from your environment as well. And what can you do to make it better? As I said, when you leave this room, what's the one thing you could do that you could change that makes your environment better or you better as a better leader? So there are a array of things, but I think it's having elements like good things like your organization, Williams, where they actually have the element of having tools. Communication is a key element here. Feeling trusted, like you belong, valued, an open door policy. These are sort of areas of reflective places that are really important for me when I see that. So I think when we have that, it's giving people the confidence to do that, the clarity and all these things, so it makes sense. And that would be my answer. I know it's a long-winded sort of way without giving you the specific one, but I think it starts from you, and every organization and business is different and department. So you are the drivers to be the leaders of your organization. And it doesn't have to be one leader. It could be an array of leaders that help you get to that winning game 90th minute or 90 minutes plus 11, as we saw in the England match, and maybe hopefully gets England to win the World Cup. So maybe you can set about what can we do to win the World Cup? Set that as your goal. How do we beat the opposition? How do we match when we come against adversity? What happens if someone's not well? What do we do? Replace them? Do we call someone in to come and support, or do we just work around and divide the tasks up? So all these things are the reality of great leadership to help us to be maximum performance. This is the sort of thing I would turn around and advise on for anyone who's out there, and hopefully they're able to take that with them and lead on. So for me, I would turn around and say, thank you very much for really joining in on that. And as I said, one of my things that's most important is mind shift. Leave here with something that you can action upon, even if it's one thing. Thank you very much.
Brilliant. Thank you for that, Dudley. A couple of nice messages in the chat. So, Stephen, thank you for your thoughts. And Nicola also, thank you, Dudley. Very informative and thought-provoking. And Stephen, yeah, we'll follow up with some resources from this session, including the recording. So, to bring this session to a close, once again, thank you, Dudley, and thank you all for joining us today. As I mentioned, we'll follow up with some resources over the coming days. And yeah, please don't hesitate to contact us if you need any support. We look forward to seeing you on more webinars, including our practice support series throughout the year. So thank you all once again.
Take care.